Hello, I'm Dr. Marla Shapiro, and I am thrilled to be on the Board of Trustees of the International Menopause Society. And today I'm joined by our president, Dr. Rossella Nappi. Rossella, World Menopause this day chose lifestyle medicine as its theme. So tell me why that was chosen, and to a woman who's listening, what does that even mean?
Lifestyle medicine is really the art of menopause care because women should be aware that menopause is not a disease, but it can bring symptoms and health risk that really need the help of the doctor, but also we can do something for that. And lifestyle medicine focusing on nutrition, physical activity, stress management, avoidance of risky substance, focusing on restorative sleep and strong social connection can really empower every woman in the world to take control of their health and to improve quality of life during this period that is so important.
So these six pillars are free, they're accessible. You just need to understand what they mean and how you as a woman can incorporate these into what you do, because it truly does make a difference. So let's talk about the pillars that you talked about. The first one you talked about is healthy eating. It seems obvious, but what can a woman do to change the choices that she's making and the foods that she eats that will positively impact her health in menopause?
Exactly, Marla. We know that healthy eating, everybody knows, is the most powerful way to support our body. But we should know that by focusing, for example, on all plant-rich foods, getting enough calcium and vitamin D, reducing what we name processed foods, can make a real difference in improving symptoms, for example, vasomotor symptoms, but also energy levels and even long-term health, especially osteoporosis, the risk of diabetes, and other cardiovascular aspects such as hypertension. By reducing salt, for example, you reduce blood pressure. This is something simple, but you can really do by yourself. Little steps every day. Every positive step counts.
Let your grocery store replace your pharmacy.
Yes, sure. And I'm Italian, and what I have to do to my patient, and I always say to women, choose a Mediterranean lifestyle, a diet that contains vegetables, fruits, all grains, and very importantly, olive oil and fish if you can. And try to cut on sugar-rich drinks, packaged snacks, add more plant-based meals. This is good for heart, bone, and weight benefit. And you can even try for soy foods if you wish. Some women, for example, they can be very much helped by these soy foods in terms, for example, of hot flashes.
Hmm. So now the World Health Organization has talked about the fact that sedentary behavior, sitting, not doing anything, is as risky for some women as smoking. So let's talk about exercise and the fact that you don't need a gym, but it has amazing health benefits. So that's our second pillar that you've identified, exercise.
Yeah, Marla, exercise. Women, they always say to my office, I don't have the time, doctor. I say, yes, you don't have the time, but remember that this is a very, very powerful tool for your health. And the best exercise is the one you enjoy. You can keep up regularly, and even small amounts make a meaningful difference. So let's start by walking a little bit more. Of course, if we consider the suggestion that we should give to patient, the optimal should be at least 150 minutes of moderate aerobic exercise each week. And I agree that some women, they don't have the time to do that, but they should aim at least to do 30 minutes, 40 minutes, 50 minutes, and then they will feel so better that probably they will go on. But also, they don't have to forget that they have to try to do something that increase their strength. So resistance, maybe little weight stretching exercise that will help them a lot. But if you don't have the time, at least walk. This is my suggestion, Marla.
And the stronger you are, the less likely you are to fall. We know falling is a risk for fracture that can change your life. And you don't have to do 150 minutes all at once. You can accumulate 10 minutes here, 10 minutes here. As you point out, it all makes a difference.
You are absolutely right, because we have always to think about what is feasible for us,
Yeah.
and then if we go one day following another, that will be positive for us and we will enjoy, because this is what I see in my office with patients. And when I see a follow up, they say, yes, doctor, you were right.
Let's talk about sleep. Sleep is so important, but why is it important?
Sleep is important because it's vital. It's vital for the brain, for the heart, for the bone, but most importantly, for emotional well-being. You feel better following a good night's sleep. And unfortunately, sometimes during the menopause, it's very difficult to sleep well because we are more anxious, because we have night sweat, hot flashes, and we are not able really to relax our body at night. We are so tired, but we are still alert. And this is the reason why it's so important that we give suggestion to women, and they have to learn and that they have to change some of their habits. Think about it. We have to stop drinking caffeine in the afternoon and in the evening, because if we do so, we sleep much better. We should not drink in the evening because alcohol, we know, is not good for the sleep. And also, we really need to be active. For example, we should exercise if we can in the first part of the day, but not late in the afternoon. These are simple things, do you know, Marla? But they can change really the quality of the sleep. And also, we have to learn some technique. You know that it's very easy nowadays. You can learn, and we can have some apps, for example, or even on the social media, a lot of good trainers, and they can teach an easy cognitive behavioral therapy to try to improve the sleep.
So one of the things that you mentioned leads us to our fifth pillar. You mentioned alcohol. What about other substance and risky substances that women use and the role that they play in adverse health and menopause?
Risky substances are out there, and the most important one, apart alcohol, it's really nicotine. And nowadays, also, as you know very well, women, they believe that the new cigarettes, the one they contain only nicotine, can be safer, but this is not absolutely not true, because smoking is always smoking, and so we should aim to quit smoking any kind of cigarettes, because if you do that, this is amazingly important, and we know, but particularly menopause is important for lowering heart disease, improving the strength of the bones, but also to improve the symptoms, because anytime you smoke a cigarette, you have a vasoconstriction that will affect the frequency and the intensity of vasomotor symptoms. And women, they have to think also that smoking is the only very well studied factor capable, apart the genes, to accelerate the aging process in the ovary, and therefore you will enter menopause early if you smoke.
Emotional well-being. Does it have a specific place in menopause?
Yes, because in menopause, emotional well-being is very important because entering menopause, it's really a step in our life. We consider ourselves different because this is really something we have to think that menopause affect the core of femininity, and therefore is not only a biological events that can affect the chemistry of our brain, and therefore we feel anxious, we may feel more depressed, irritability, this and that. But really, menopause has a meaning depending on our achievement in life. Think about women, maybe they experience infertility in their life. When they enter menopause, they can feel different in comparison to other women. Women, they enter menopause right away for due to surgery, unfortunately, due to cancer treatment. So we really need to consider these aspects, and this is the reason why we really need to help women to embrace this period of their life with positivity. This is the reason why you should talk to your doctor anytime you feel low mood and you look not with the pink glasses at life. You should discuss with your doctor, and there is always a solution that we can find together.
The last pillar, which is such an important pillar because we know it's the single most important predictor of healthy aging, but has a role in menopause as well, is the notion of being social, being socially connected, and having supportive relationships.
Yes, Marla. Uh, every woman should not stay alone. And we really need to consider, it can be a partner, but it's also friends, it's family, it's the entire community. And we have to consider that nowadays, even if you are alone, you may be connected in any different way because even menopause groups and think about menopause cafe, even on the social media you can be connected, but of course the touch of human beings is much better, and we know that to be in an healthy relationship, it's really vital for many different aspects, and you can lower disease, you can ease symptoms, and you can promote an healthier life. And we have to talk openly also about our menopause, because when we share information, we feel that we are not alone, and we overcome the stigma, the taboo of menopause, and we can really share our experience. And in this way, we will have the support of our network. And don't forget, if you have a partner, even intimate relationship can be so crucial to feel a woman forever.
I think, that as you've gone through these 6 pillars, it's such an empowering message to women because what you are telling women is there are 6 areas that you can make changes that don't cost anything in terms of dollars. It's a change in attitude and a change in behavior that can make a difference in terms of your health impact, your emotional impact, and the strength as you face menopause. And menopause, 1/3 of our life is spent in menopause. So let's face it, in health.
Smangla, this is really our aim as IMS says, to try to provide equitable care to every woman, irrespective of the area of the world she lives. And this is the reason why everybody should try to follow the lifestyle that it's really in our culture, in our environment. And of course, if something more is needed, doctors are there to help. But we can do a lot for ourselves. And so, please, all women of the world, do it and put into practice some principle of lifestyle.
Thank you so much for joining us and giving us all your expertise.
Ciao.
Ciao, ciao.